Assalamu alaikum. I am Dr. Mamoon Qadir. I'm a consultant cardiologist at Kulsum International Hospital, as well as I'm a head of the cardiology department of Federal Government Polyclinic Hospital. Smoking obviously is one of the major risk factors in coronary artery disease. Coronary artery disease, what we mean from that is basically it's the blockage or narrowing of the coronaries, where your blood supply doesn't go to the muscle of the heart appropriately in a nice smooth flow, and it's been obstructed. Therefore the oxygen supply to the tissues or muscles of the heart is not enough, especially when you are doing more stressful activities or exercising. Then people get, we call it as a ischemic pain, but it's a kind of cardiac pain, is more pressure on the chest, mainly on the left side, but it can radiate to your left arm and can radiate to your neck. So this kind of presentation it can be associated in major heart attacks with sweating or nausea or vomiting. In that situation, obviously we recommend people to come to the hospital, but if it's just a plain angina or a stable or progressive exertion angina, then we tend to see them in outpatient clinic and guide them accordingly and do some investigations, which I'll come later on. Now coming back to your question, so as I said, there are quite a few risk factors, like suppose for example male gender, Asian origin, females above age of 50, people who have got diabetes, people who have got high blood pressure, and family history. These are some of the common risk factors. And not to forget smoking. Smoking has been an emerging major risk factors. On daily basis we see quite a few patients who comes with the heart attack, and we have to deal with them. And since I'm involved quite often in doing their angiographies and angioplasties, therefore it's so crucial. We have seen young people, especially of Asian origin, coming with major heart attacks, and there is no other risk factors but smoking. So that's why it's so crucial, so that we can ask our community and request the people who are excessively smoking to quit it, and you would see the difference. It starts within first month. तो स्मोकिंग तो आजकल अगर आप नोट करें तो जिस तरह दुनिया में सारी जगहों पे स्मोकिंग का रुझान बढ़ रहा है, इसी तरह एशियन पॉपुलेशन में, हमारे मुल्क में भी स्मोकिंग यंग जनरेशन में बहुत अर्ली स्टेज से शुरू हो जाती है. और स्मोकिंग में ये है कि स्मोकिंग एक एस्टैब्लिश्ड का मतलब है बाकायदा साबित शुदा रिस्क फैक्टर है कॉर्नरी हार्ट डिजीज़ को, जिसको हम कहते हैं कि जो हार्ट अटैक या शरियानों की तंगी या हार्ट अटैक वाले मामलात में स्मोकिंग बिल्कुल एक रिस्क फैक्टर्स हैं. इसके अलावा स्मोकिंग ये करता है कि शरियानों को तंग करता है और उसकी वजह से या उसको हम स्टिफ या सख्त कर देता है, जिसकी वजह से उसमें ब्लड प्रेशर ज़्यादा हो जाता है. और ब्लड प्रेशर, दोबारा से बता रहा हूँ, ब्लड प्रेशर भी एक रिस्क फैक्टर है. तो स्मोकिंग खुद भी रिस्क फैक्टर है, साथ में ब्लड प्रेशर ऐड हो गया, अनदर रिस्क फैक्टर ऐड हो गया. इसी तरह ये पाँव की रगों में या दिमाग की रगों को भी ब्लॉक करता है. Passive smoking, like active smoking, when you are inhaling cigarettes, you smoke directly into the lungs. So obviously you're kind of depriving the body of oxygen, as well as this goes into the arteries and the arterial effects I've mentioned, but it definitely reduces your oxygenation, which obviously has more deleterious effects on the rest of the your breathing systems, your arterial system of the heart, and so on and so on. It can cause lots of cancers. If I start to enumerate the problems associated with smoking, is numerous. So passive smoking, the smoking has got different effects. Some are on receptors, some are directly of the smoke ingested and inhaled into the lungs. So that smoke in the passive smoker can also happen, because if someone is smoking and constantly smoking in front of you, or the environment gets more husky and dusky because of the smoke, and obviously you're not breathing good fresh air and you're just ingesting or inhaling all the smoke, obviously it would have the similar kind of equivalently dangerous effects of the of the smoke, so it should obviously be avoided. The solution for the problem is smoking obviously has a numerous side effects, starting from cancer, coronary disease, as I've been explaining it previously. So how do we stop smoking, especially in chronic smokers who have been addicted to it? It's very hard to stop smoking, there is no doubt about it, but motivation is the key to majority of the success, and we have seen that people who are more motivated can stop it right away. Or some people we refer to a counseling session, or with the help of our psychologist and psychiatrist, they take some sessions with them, and then gradually we taper off, along with the help of some medication, those who are heavily addicted to the smoking. Then there is a special regime for that, and we have got a special team for that. They get involved in it. And abroad we used to have a rehabilitation and smoking quitting teams, so they used to get involved with it. They used to have special leaflets, information, counseling sessions, and we start off with providing them some nicotine gums, chewing gums, which are available with us in good stores here. Not to forget, what smoking does is not just you alone. The problem with this thing is that it affects the rest of the people in your surroundings, especially your family members. If you're smoking continuously, they get affected with the passive smoking. Secondly, the personality is a little agitated. We have noticed, you feel at unrest everywhere, and you want to go out and smoke, so your personality changes are there. And obviously the medical side on one hand, but it's the other psychological aspect of the smoking is also not good. Secondly, it affects your family, it affects your family life too, and affects your collegial life in your working environment. So lots of these things should be kept in mind. एक ये तरीका है कि एक साइड पे आप एक्सरसाइज स्टार्ट कर लें, दूसरी साइड पे अपना विल पावर, काउंसलिंग सेशन, हम मेडिकेशन से हेल्प कर सकते हैं, लेकिन एट द एंड ऑफ द डे इट्स यू एंड योर लाइफ एंड योर फैमिलीज लाइफ विच मैटर्स, और ये चीज़ है बहुत ख़तरनाक। तो सबके लिए वो है एडवाइस यही है कि इससे यंग एज में बच्चों को, सबको, फैमिली को बचाते रहें, because it can have a significant effect on mortality and morbidity in our community.